The senator from Ohio.
I assume a number of my colleagues have seen the movie Lincoln, and one particularly brief but poignant moment of that movie showed the president's staff had discouraged him from spending so much time talking to regular people, leaving the White House, inviting just normal people that weren't in politics every day or didn't work in the White House into the White House to talk. And they were saying, "You're president, you got to run this war. You've got so much to do. You shouldn't be meeting with people this much." And Lincoln said, "I need my," he said to his staff, he said, "I need my regular public opinion baths." And I guess I would, when I just listened to the last two speakers, particularly the Republican leader, I think it's important that more people in this institution go out and talk to real people who are affected by this health care law, who've already, the 25-year-old who's already benefited from staying on her mother's health care plan, the person in the high-risk pool that has insurance now. So a friend of mine in Ottawa County now does, in Port Clinton in Ottawa County in Ohio has, because of this law, people that have seen the consumer protections, they haven't lost their insurance because they've been expensive for an insurance company. My colleagues need to get a public opinion bath and walk around their states a little more, maybe, and listen to people outside of the country clubs and outside of the trade associations, which are charged ideologically and not really particularly open about these kinds of issues. I rise to oppose the amendment offered by Senator Cruz, the badly named Restore Growth First Amendment that would prohibit resources included in the continuing resolution to be used to implement the Affordable Care Act. Specious claims about how the health law will harm our economy have already been debunked by the hundreds of Ohioans who are able to have annual wellness visits, by the tens of thousands of young adults staying on their parents' plan, as I mentioned, by the seniors who are seeing the donut hole coverage gap closing with real savings on prescription costs. It's been debunked by Americans who are no longer denied coverage because of pre-existing conditions, by the Americans who are not forced to pay more for insurance because of a pre-existing condition, by women who now can rely on affordable, accessible reproductive health services. And starting in 2014, Americans who have not been able to afford health insurance in the private market will be able to comparison shop and receive assistance if needed to purchase insurance. These much-needed health care reforms, which will benefit Americans next year, are already benefiting Americans and have been for a couple of years. Continued implementation of these reforms is crucial for improving the quality of care and bending the cost curve. I agree with Senator Cruz on one thing: health spending is related to the economy and to the deficit. But let's be clear, we know that health law will reduce the deficit by over $100 billion over the next decade. That's Congressional Budget Office numbers. That's not Republican numbers or Democratic numbers. Repealing the health law increases, the Cruz amendment, repealing the health law would increase, not reduce the deficit. And we know how it's helping people. 100,000 reasons in my home state of Ohio to stand up for this health law and reject this amendment. 97,000 of Ohio's young adults are now able to stay on their parents' plan until 26.
Would the senator yield for a unanimous consent request?
Of course. Senator.
Yes, ask unanimous consent. At the conclusion of the senator's remarks, I may be recognized.
Without objection.
Almost 100,000 Ohio young adults have been able to stay on their parents' health plan. Seniors have saved almost $300 million in prescription drugs just since the passage of the health law. Per average beneficiary savings, $775. 147,000 small businesses in Ohio are eligible for tax credits. Finally, thanks to the health law, more people in my home state and across the nation have access to free preventive services. I said 100,000 reasons for Ohioans to like this law and oppose this amendment. There are 2 million Ohioans with private insurance who have gained preventive health services with no cost sharing. That means major illnesses can be detected earlier. It means decreasing treatment costs and human suffering over the long term. The Affordable Care Act is the most promising initiative to control health care costs in decades. The health law is about reducing costs for consumers. It means investing in more affordable preventive care for Americans now. And as I said, the health law is about containing cost as we extend insurance. It means that people, rather than going to the emergency room with a sick child, can go to the family doctor and get preventive care prior to the child's ear infection getting so serious. The new medical loss ratio rules state that health insurance plans must spend at least 80% of premium dollars on health care costs, not executive bonuses, not other administrative expenses. In Ohio, 143,000 Ohioans receive more than $11 million in rebates as a result of this. The Prevention and Public Health Fund is the part of the law that will give us test data about how to bend the cost curve through preventive programs. Ohioans receive more than $17 million already to prevent chronic diseases and decrease smoking rates.
Would the Senator yield for a question?
Certainly.
I'd like to ask the Senator.
Senator from Illinois.
Pending before the Senate now is the Cruz amendment, which would literally remove any funding to implement the Affordable Care Act, as I understand. Is that correct?
Correct.
And we have heard from the Republicans on that side of the aisle that they oppose this intrusion of government into health care and creating insurance exchanges so that Americans who currently don't have a choice in health insurance and want to get a different policy, if they care to get one, would have a choice through the exchanges?
That's what they've been saying, yes.
And the premise behind this has been the government shouldn't be involved in this, as I understand the Republican argument. Is that correct?
That's what they say.
And did I hear the Republican leader come to the floor and talk about thousands of pages of regulations, government regulations that will now be part of health care?
Yeah, he did.
I'd like to ask the senator from Ohio, is he aware of the fact that every member of the United States Senate has a government-administered health insurance plan?
I'm aware of it. I assume my colleagues are too.
Are you aware of any senator on the Republican side who has come forward, and there may be one, I don't know, who has said, I am so opposed to government-administered health care that as a United States senator, I will not take advantage of the federal employees health benefit program?
I've not heard any say that, Senator Durbin.
So the same senators who are critical of Obamacare because government is involved in health care have themselves, their families, and children protected by a government-administered health insurance plan?
That's my understanding. That's been sort of the hypocrisy woven through this debate over the last 3 years.
So though it's good enough for these United States senators, it's not good enough for the rest of America? Is that the
Apparently
point?
not good enough for a senior, not good enough for somebody who's low income but's working two $10 an hour jobs. I guess it's not good enough for them.
And is it not true that the amendment by the senator from Texas is breathtaking because it says we eliminate all funding for the Affordable Care Act in terms of, for example, the extension of the availability of health insurance for your children up to the age of 26? They can't, as I understand the Cruz amendment, we couldn't fund that aspect of the Affordable Care Act.
The Cruz amendment takes away, doesn't just anticipate changes in the future, it takes away all these services that have been out there that I've been talking about, the thousands of people in Illinois and Ohio and Wisconsin who have benefited from 25-year-olds, 22-year-olds. Somebody graduates from Champaign-Urbana or Madison or in Columbus and they don't have insurance, they have a job, but they're 23 years old, they can stay in their parents' health plan. All the preventive care that literally hundreds of thousands of seniors in Ohio now get with no copay or no deductible, that would be wiped away. So, all the other provisions that people have benefited from already are taken from them by this amendment.
So this breathtaking Cruz amendment would actually say to these families with children who are currently under the family policy up to the age of 26, it's over. Those kids are now on their own to find their own health.
These kids would be on their own, but the senators who are pushing this amendment would still have their health insurance.
To
remind you of
the Cruz amendment does not eliminate the government
doesn't take away the insurance for those people voting on this, correct?
So the Federal Employees Health Benefit Program, which protects the United States senators and congressmen, is not affected by the Cruz amendment?
My reading of it is that it's not affected.
So they don't hate that aspect of government-administered health insurance?
Apparently not, Senator Durbin.
Well, is it also true that the seniors who get benefits under the Affordable Care Act, for example, annual physicals that are available, that those would be eliminated as well?
In my state and your state, because your state's slightly larger than mine, over 1 million seniors in each state and hundreds of thousands in the presiding officer's state of Wisconsin, millions of seniors have gone in, gotten some kind of preventive care, got screenings for diabetes, screenings for osteoporosis. and not paid a copay or deductible, gotten physicals, and not had their copay or deductible waived as a result of the Affordable Care Act, the Cruz amendment would, while still protecting health insurance for Senator Cruz and others, would wipe away those benefits for seniors.
Is it also not true that here in the United States Capitol we have an attending physician's office run by the United States Navy, a government entity, which makes itself available if each senator cares to pay a monthly fee for annual physicals for senators, a government-administered annual physical for senators?
It's true. That is true, and that's open to people regardless of how they vote on the Cruz amendment.
So does the Cruz amendment eliminate this government-administered physical exam that's available for members of the United States Senate?
It does not.
I'm starting to note a pattern here, that the senators who want to do away with government-administered health care for everyone else want to keep it for themselves. Does that pattern emerge in your analysis?
We had this discussion back in 2009 and 10 when we debated this health care law that members of the House and Senate continue to get health insurance. And I recall one House member was unhappy campaigning against the Affordable Care Act because he just came to the House and he didn't get his insurance for the first month, paid for by the government as he tried to take away insurance for low-income, moderate-income people in my state, in my district, in your state.
Well, I would say that Senator Cruz would certainly be able to offer an amendment that eliminated all government-administered health insurance as it applies to any person in the United States. If he did that, he would be consistent. But instead, what he's done is to go after those today who are struggling to find their own health insurance, cannot afford it, and are simply asking for the same option as members of Congress have today, to go to an insurance exchange and choose that insurance plan that is best for them and their family. I think it would be more consistent, and I asked the senator from Ohio, does he think it would be more consistent?
I'd like to see Senator Cruz or one of the supporters of the Cruz amendment to offer an amendment like that.
Thank the senator from Ohio.
I appreciate the words from the senator from Illinois, and I'll yield for a moment to the senator of Oklahoma, but just close with, I think Senator Durbin's comments exactly explain that there is a bias in this institution on tax policy and health policy for some senators to take care of themselves and people like them a little more than paying attention to the rest of the country. I think that amendment shows this. That's one more good reason to vote against the Cruz amendment. I yield the floor.